Welcome everyone. Welcome back to another episode of STC's podcast, Interpreting in Healthcare. And I am so psyched to have two of my favorite people here with me today, representing language access in professional roles and also Certification Commission for Healthcare Interpreters. So let me do a quick introduction of you both before we jump into telling us all about what is coming up for CCHI, because I know you've got a busy season ahead planned for us. So quickly, Jorge Ungo. Everybody who is part of NCIHC knows Jorge, but for those of you who don't, Jorge has been involved in language access for a long time. I think we first met at the second annual membership meeting in Atlanta. It was a long time ago. And I met many good people who have remained my friends since then. You've been involved with language access, with social justice, with relationship management, and more recently, real estate development. So over the last 2 decades, Jorge has supported healthcare organizations in their efforts to deliver compassionate, culturally competent, patient-centered care to their diverse patient populations. During this time with his husband, he began a real estate investing journey, which led them to their current home in a community on the brink of erasure due to redevelopment. So they set out to revitalize homes in their neighborhood, creating safe, quality, and affordable housing while preserving the rich cultural heritage of their historic community. Jorge is passionate about uplifting marginalized communities, being a vocal ally for the underserved, and supporting efforts to address systems of inequality based on race, ethnicity, gender, sexual orientation, gender identity, disability, or class. Kudos.
Thank
And
you.
together with Jorge is Johanna Parker, a conference interpreter, a medical interpreter, an interpreter trainer. Johanna holds a MA in translation and interpretation with a language pair of Spanish English, with advanced simultaneous interpretation from the Monterey Institute of International Studies, a professional certificate in translation, consecutive interpretation, and simultaneous interpretation, again from Monterey Institute of International Studies. She is also a federally certified court interpreter and a California court certified interpreter. But what is most interesting to me about both of you is that you are now both working with CCHI. So welcome, and tell me more about this new role of yours, Jorge. And Joanna, tell me more about your role at CCHI.
Awesome. Well, thank you so much, Eliana, for having us. And likewise, Johanna is one of my favorite people to work with at CCHI, and you have been one of my favorite people to work with as a past commissioner at CCHI. So I'm thrilled to be here with both of you. But yeah, I have a new role at CCHI. I was a commissioner with you, Eliana, and briefly, I think, Johanna, you and I were commissioners together maybe for like a month or something. But this past year, I came on board as staff at CCHI in a new role as the language access advocate. And in that role, part of the work that I'm doing is to help CCHI expand beyond the healthcare interpreting community and really liaison with other professionals, other people in healthcare, other organizations in language access as well, just to make sure that we are abreast of what is going on and keeping our stakeholders up to date on that, but also to make sure that language access isn't an afterthought, that is top of mind for other people out there, that are maybe working on other things that impact the patient populations that we serve, but language may not be the first thing that they're thinking about. So I'm thrilled, honored to have this opportunity to work with CCHI and to work with our executive leadership team, of which Johanna is a part of.
Yeah, and this is just a love fest because I am so glad to have Jorge now working with us, even though he after his term as commissioner, And Eliana, it's fantastic to be able to spend some time talking with you about something that all three of us love. I'm the new vice chair of CCHI. This is the beginning of my third year on the board, I think. Yes, my third. And I'm just really excited to take on a leadership role within CCHI, because I think that the work that we're doing right now is so important. And I came on the board and to this position at really an amazing time, because it was at the end of a very long effort, a lot of work put in by previous commissioners, including the two of you, to really make some changes and implement some things that, and what we'll talk about, that really will have an impact on this profession in a very profound way, and a way that I'm very proud of. And so now the work is done in the creation of our new certification, the course CHIP, and we're looking towards the future. What do we do with this? What's next? And so I'm so happy and grateful to be part of that conversation at CCHI.
Well, I am really proud of where we started and where we are now, but that doesn't mean that we can become complacent. I think now there's even more work ahead to try to stop preaching to the choir, as Jorge and I were talking about before. Not stop making those connections with people that are doing the same kind of work that we're doing, but expand beyond our small pond and try to get to that big ocean of clients and end users, and making them aware of the fact that it's the law. And there are so many more better ways to do this than there were 10, 15, 20 years ago. The ease of access, for example, many places. I mean, I started with video remote interpreting at my hospital in 2008, but there was still a lot of hospitals that were resistant to video remote interpreting in 2020. The courts, it was always never. And then what happened? The pandemic. Everybody got thrown into the pool, regardless of whether they knew how to swim or not. And it may have been very stressful at first, but things have been worked out, and protocols have been worked out, and vendors have been sourced, and this is getting done virtually everywhere. So that benefits remote populations, that benefits speakers of languages of limited diffusion, that also enables interpreters for languages of limited diffusion to actually be able to earn a living, because they're no longer restricted to their immediate vicinity for the number of jobs that they can get. So this is all good, but this all brings with it a lot of responsibility, as well as a demand for even more effort to keep pushing this in the direction we'd like to see it go. So like I said to George earlier, we have to stop preaching to the choir and get out of the church and start knocking on doors to make sure that everyone is aware of the law, and also the ease with which they can hold up their end. So that leads me, we have a little bit of retrospection in that comment. Looking back, whether it's through CCHI or in your own work in language access, what makes you the most proud, or what do you look back and see as that sentinel moment that really made the difference or cemented your commitment? I'll start with you, Johanna.
You read my bio, and I was trained as a conference interpreter. But I did an internship in medical interpreting and really fell in love with it. And I fell in love with it, I think, because it was fulfilling to me in a very different way than conference interpreting is. Conference interpreting is exciting, and it's intellectually stimulating, but medical interpreting, in addition to obviously being interesting and learning about science and being in that exciting environment, it really is important to me to fight for our community. And we all put our little grain of sand in the battle for equality, in the struggle for equality. And for me, serving immigrants and helping them achieve equal access to the healthcare system, has been really important. And I don't pretend that just because I'm there, all of a sudden the person I'm interpreting for has equal access to everything. No, of course, there are all sorts of barriers, but it's important to me to participate in that. And so I'm proud that it took me a while to sort of to see it from that perspective and see that medical interpreting wasn't just a for now job, but rather a forever career and a field in which I could really make a difference. So personally, I'm proud of that, and I've worked to position myself as someone who advocates within the broader T&I community for healthcare interpreters, um, um, and not yes, for the benefit of the interpreters, but in the end, so that we have quality interpretation, quality language access for the patient. So that's what I am very proud of personally. And then with CCHI, the fact that we have rolled out a performance-based certification for any language and not replacing our language specific certification exams, but something that will always, an exam that will always be there for that language N+1, is incredible, and I think is a huge step towards professionalization of our career, towards implementing standards that require certification across the board, because now we have a certification exam that really means something and says that this person has the skills. And I'll pass it to Jorge, although I imagine I might have stolen your thunder just a little bit with that one.
My gears are turning. What am I going to say? Um, so yeah, for CCHI, super proud of having this new opportunity for interpreters of any language. For so many years it was Spanish, Arabic, Mandarin, right? And everyone else had Core CHI, which in and of itself was incredible. But now there is this opportunity to have that next level of certification, regardless of what language it is. So yes, it's going to improve the what patients get from interpreters, because now they have something that they can measure their skills with. But I believe it also helps to empower interpreters to feel proud of the work that they're doing, by being able to get that full certification that are Spanish, Arabic, and Mandarin interpreters. So definitely super proud of that. Also super proud of just the vision that CCHI has had. I've been an observer of CCHI from the very beginning. Was a commissioner, later on was a volunteer, and now staff, and am just always so taken aback by just the laser focused vision that Natalia has to ensure that we are giving back to our stakeholders, that this isn't just let's certify as many people as we can, but let's do this the right way. Let's do this in a meaningful way, but let's continue to give back to that community. So super proud to be a part of CCHI, and super proud of the work that CCHI does. On a personal level, I think I spent a lot of my career with imposter syndrome. I was the non-interpreter. I was trained as an interpreter, but never felt that I had the language skills to really do the work that interpreters did. And I spent a lot of my time managing interpreters, or But then the majority of my career was in sales, right? Selling interpreter services to healthcare organizations. And that's where the imposter syndrome really set in, because I never saw myself as a salesperson. But what I did, the skill that I did find that I had was in being able to talk to people at different levels about language access, whether it was a nurse on the front lines that is really, really busy and doesn't have time to talk to somebody who's trying to give, the elevator pitch of why language access is important, to having to talk to people at the C-suite in the hospital organization. And I feel proud in that I was able to do that, but always in the back of my mind, keeping the interpreters and the patients that we serve at the forefront of my mission, of why this conversation needed to take place. It wasn't about dollars. It wasn't about closing a deal. It wasn't about selling anything. At the end of the day, it was my ticket to get inside that organization and have those conversations with the frontline staff to ensure that the next LEP patient that they had, that next deaf or hard of hearing patient that they have, wasn't going to get subpar service because they didn't know, or it was too hard, or they just didn't have time. That conversation that they had with me was hopefully the seed that was going to create a better patient experience for the next LEP patient. So I'm proud of that work that took place, and I'm grateful that it brought me to a place like CCHI eventually, to continue to have those conversations with people at all levels.
And I think it's so important what you said of being able to connect with people in all environments, different backgrounds, different languages, but to be able to make that connection personalized in some way. It's totally different than getting a directive via email or an announcement overhead for a code, when you can foster a real connection, talk about something, even if it's only 2 or 3 minutes. And then when you reach out to that person again, you stick out. You're not just a
Yeah,
name of letters, black letters on a white page. They remember that moment with you. And I think that is where we are now in terms of having to step outside of our silo of interpreters and localizers and translators and voiceover artists and subtitlers. Like, all of us in that room get why language access matters. But we'll always pretty much be in agreement that yes, it does matter, but we have to get outside that and start talking to the people that write the code, and start talking to people who write the legislation, and start talking to people who put out those public service announcements, um, to also share the vision that we have for how this could work better. And we all know that even though you invest money in having access to language services, that having access to language services makes you spend less money in the long run. For the medical data, length of stay for patients is reduced when they have access to an interpreter. Readmission rates are lower when they have access to an interpreter. Medication errors are less frequent when they, et cetera, et cetera. So it is a cost savings that you have to invest in upfront, but that needs to be a given in the C-suite. It can't be new knowledge. I'm tired of people pretending like they don't know what Title VI is. I am older than Title VI, but just barely. All of you out there should know something that's been around for over 50 years. I'm sorry. So, what do you see currently as the biggest challenge for us to make that move from everybody in the room being in agreement to being able to spread out and infiltrate our North American healthcare culture and make the change that we want to see happen? Jorge, this time I'll start with you.
for sure. So it is it's a numbers game, right? I think back to my sales training, right? And in order to close a deal, you have to make a lot of calls, right? And so I think, it is a matter of trying and trying and trying over and over and over again to have these conversations at every potential level that you can. You and I were talking before we started about, who's having the conversation with, the American Hospital Association, who's having it with the American Medical Association, but who's having it with the National Association of Anesthesiologists, who's having it with the National Association of Dentistry. All of those are opportunities for us to improve care by incorporating language access into their curriculum, into their continuing education, just into their dialogue in general. So I think it's the biggest challenge is stamina, right? And all of us kind of being on that same page of continuing to have these conversations outside of our community. I think we do a lot of good when we work together, and I think that we as a community tend to be very collaborative in that sense. So I'm not saying that we should just stop talking to each other, but I think that we should continue to talk even more outside of our
Yes.
schools. The other challenge that I see for the profession is that I see a sense of disheartenedness amongst some of the language access professionals that I work with. I'm on a lot of forums, right? Because of the work that I do with CCHI, I'm on a lot of online forums. Everybody knows that I'm a social media enthusiast. So I'm constantly, reading comments and hearing things, and I just feel that there's this sense of a little bit of doom amongst interpreters out there, whether it's because AI, whether it's pay, whether it's working conditions, whatever it is. I don't want to see people leave this profession. This is just such an incredible profession, one that I wish I would have found earlier in my career so that I could be a core CHI or a CHI along with you all, so that would have been my profession, because I'm such a fan of it and of the people that do it. But I just fear that people may be that this doom is this feeling of doom is out there, and how do we counter that? So I think that's a big challenge for those of us that are in a leadership position in this profession, is how do we counter that, and how do we keep our colleagues enthusiastic about the future of language access, regardless of AI or whatever else is out there that people fear, because the fear is real.
Israel.
Jorge, I know that I hear you saying you wish you had been able to be an interpreter because you're such a fan of it, but I have to say that people in leadership positions like you, who really do have that deep understanding of the field of language access needs, bring so much value. So you are contributing so much, and perhaps even more than you could or would have as an interpreter, by getting into those spaces that you've been in. And I agree with a lot of I agree with everything Jorge said. And I think that there are, and the point about the sense of doom is really interesting and absolutely true. But in terms of how do we break down these silos, how do we stop just preaching to the choir and really get the message out there in a way that causes a rapid change and a shift in language access? I think there are we can divide the challenges in two ways. One is systemic. The fact that the healthcare system is set up around time efficiency and profit makes it really hard when there are patients who have a right to additional resources and additional time, because the use of that resource takes a little bit of time. It is hard for people, even if they say, oh, yes, we want that for our patients, it's hard to actually make it happen. A physician, that I know talks about how, I'm given 15 minutes for my appointments. And if I have a patient who requires an interpreter, I either have a shorter conversation with that patient because of the time that the interpretation takes, or I have the full conversation, and then what do? Take time for my next patient? Like, so it's, or end my day really, really late. And then it's always, oh, there's always someone who has to pay the price for that. And it's a systemic problem that I don't have great solutions for. What I do think, the other side of it is the challenge of um, making our end users become the champions for language access. It shouldn't be coming all from the service providers, be it the interpreters or the directors of interpreter services or the language service companies. Um, and we're in a moment right now in our country where DEI, diversity, equity, and inclusion, is a hot topic. But we need to make sure that we are at those tables so that the DEI conversation includes language access and language access done right. So absolutely, yes, going to, working with physicians, because the administrators at the hospitals, the C-suite is going to listen more to the doctors than they
Yes.
are to the interpreters. Working with presenting at, not just presenting at interpreter conferences, not just presenting at language access conferences, but presenting at the conference of the American Anesthesiologist Society, or whatever their organization is called, to really get the end users to be the champions. And I was going to say one other thing. Oh, it flew out of my mind, but yeah, I think that's really really a key piece of it. Oh, I do remember what I was going to say. And another challenge that we're facing is, and I think part of the thing that part of the reason that interpreters have this sense of doom is with globalization of remote language access services. Interpreters are afraid of losing their jobs. They're afraid of their fees being cut, because they have been, because people in other countries are willing to, work for less because they're in different economies. And I think it's a matter not of shunning the foreign workers. Those people have a right to make a living just the way we do, but of, first of all, some sort of international collaboration, but especially the setting of standards for interpreter skill, et cetera, for certification. Because imagine if every single telephone interpreter had to be certified. Well, those interpreters working in Latin America would no longer be willing to take the low wages that they're being paid. Certified interpreters in the U.S. working for all LSPs would be able to advocate for a higher wage.
Yeah, those are critical points. Being included in the conversation at the beginning of any new process or development of an application or updating of an internal hospital system or medical record, electronic medical record, all of that is really, I'm really past the point of being the afterthought. Like, oh yeah, we got to figure out what to do for language access. Oh yeah, we got to figure out how to put in a field to document that an interpreter was requested for this limited English proficient patient. We have to figure out, and we have to contact the people that we need to have those relationships with, so that we'll get the invite at the start, rather than the, oh, we overlooked this section and now we got to figure out how to shoehorn it in. And it's never as elegant as it could have been if we had been there at the beginning, right? When you start to design the process, you can put in all the customization that you want. After it's completed, putting in an awkward add-on for interpreter services is always viewed as, with a lot of huffing and puffing and eye rolling. And I'm past that. We are not an afterthought. We need to be there at the start so that we can help guide a process that is seamless. What good is having a great core of staff interpreters and contracts with agencies for those rarer language requests, if your phone tree doesn't allow a limited English proficient person to contact interpreter services, I mean, it's got to be more holistic than it is. So that leads me to our last question. Looking forward, what do you see as either the biggest challenge or what would you really love to see happen? Jorge?
Looking forward, so I think this is where I get to plug the fact that CCHI is celebrating 15 years of national healthcare certification next year, and we as an organization are looking forward, looking to see where the next 15 take certification. So with that said, I'm excited at the prospect of expanding certification, right? We did this big thing. We did this really big thing by having a performance credential that any interpreter of any language that interprets into and from English can get. Where do we go next? I'd like to see certification available for other professionals in our ecosystem, language service leaders, for language service leaders to be able to have a credential that they can attain. I've having been in this role of a consultant, of a subject matter expert to my clients. A lot of times I would get contacted by someone at a VP or a director level saying, we're hiring a new manager of language services. This is a phenomenal person with great, people management skills, but they don't know anything about language access. Where do we start? Where do we train them? So developing a training curriculum for new leaders, because it's more than just knowing what code of ethics interpreters should follow or what the standards of practice for the people that they're going to be managing, right? It's more than knowing that. It's knowing the legislative background, knowing how language services have been rolled out in the past, what options are there for them so that they're not starting from ground zero. So similarly to how we developed training for interpreters, and then from there we led to certification. I would love to see certification for other people like myself that are in this field, right? And that have this expertise, but want to be able to get credentialed for that. So I think that would be really, really amazing. Whether that's something that CCHI does, who knows? But something that I think that the field really could use, because we've got a lot of leaders out there, and not all of them are former interpreters. And so let's continue to grow that pool and have more leaders like that.
Yeah.
That is such a great idea. And that's the first time that I've heard that idea. Yes, I've heard complaints that providers need more training on how to partner with interpreters so that the session goes more smoothly and you waste fewer of those precious minutes. But a certification as a culturally and linguistically competent manager of language access services, that would be awesome. Johanna, what are you thinking about for the future?
Well, similarly, I see certification as a really, really important part of professionalization of healthcare interpreting, of equal access to healthcare for speakers of languages other than English. And I think Jorge's idea is fabulous. I also want to see more advanced certifications. I want us to show. I want the skills required recognized, and the current certifications are certifications for entry-level interpreters. We've got a lot of really advanced interpreters working in healthcare, and we have a need for those kinds of interpreters. The people who can walk into really, really complex tough situations and just do a fantastic job. So I'd like to see that. I think though that our biggest challenge around certification is still, yes, we want to grow up, but we need to go out, just plain numbers. There are thousands and thousands of interpreters working in healthcare in the United States, and a very small portion of those are certified, unfortunately. And the way to do that is working on all levels. Yes, advocacy and language access, et cetera, is important, but really working from those higher levels to get the requirements put in place, requirements for training. We've all talked about for years that 40 hours isn't enough, 40 hours isn't enough. That needs to change. And I think that it is important for us to continue to grow the pool of strong advocates for language access, for certification, for the professionalization of language access in healthcare. And whether that be, with end users, or just within, frankly, the TNI industry. I want conference interpreters. I want legal interpreters. I want all of those interpreters clamoring for all healthcare interpreters to be certified. And so I think that extension, that broadening of the advocacy for certification, but not for the sake of certification or for the sake of CCHI, but certification as a marker of a quality standard, is really key.
And I agree, 40 hours is not enough. I'll give an example. My daughter's a teacher, but while she was in school, she was a yoga instructor. And to get her basic level of certification as a yoga instructor required 400 hours of training. And then to get the master level that she has was 1,200 hours of training. So 40 for a healthcare interpreter is really not enough. Everyone out there, please don't panic. But let's look at what's available. Standards and Training Committee of the National Council, which I chair, is trying to look at programs that are greater than 40 hours, but less than an associate degree, which there has been such an expansion of what is offered online. So if anyone out there has a training program that's more than 40 hours, but is less than an AA, please get in touch with us at trainers webinars at NCIHC. We're putting together a list of what all's in your table of contents so that we can look and see what is shared and what is unique amongst all these training programs to try to offer some guidelines on what should be included, still giving you plenty of latitude to design your training as you wish, but the basics that should be there. Because if it's not going to happen on its own, we've got to push to make it happen. Just like we were talking about before, we've got to reach out to those allied healthcare professional organizations, not just sister interpreter organizations, and make friends, everybody. Get out there and find a new pal. And then when the moment comes, then they know, oh, we're talking about language access. I know this person because they reached out to me. And that's how it starts. And to your point at the beginning, Jorge, we have to be relentless, relentlessly persistent, to really make this happen sooner rather than later. So thank you guys for being in the trenches with the rest of us and fighting to level this playing field out just a little bit more. This is what this country is supposed to be about, the land of opportunity, but also opportunity that is based on equal access, right? That is what makes this place very special. So yeah, interpreters are triggered by fears of AI taking over their jobs, just like they used to be triggered about video remote interpreting, maybe making their jobs go away. Don't be triggered, folks. Get the training, be the interpreter that has the skill set to work with AI apps, but also to edit and vet them, just like interpreters that are trained to provide service remotely have more jobs to pick from than interpreters who exclusively only interpret in person. Um, so yeah, that's my recommendation for all of you all out there. If you have some training curriculum you want to share with us, send it to trainerswebinars@NCIHC. And please join one of the organizations. It doesn't have to be NCIHC. It might be the regional organization. Promote CCHI and NBCMI to your hiring managers. Make sure they know about it. And thank you, Jorge, and thank you, Johanna, for being here with us today to get that message out. The time is now to break out of our silo and to go out and make friends and find that healthcare worker, doctor, nurse who will be our champion. Because when the doctor says, hey, I need a new MRI machine or another X-ray machine in the clinic, people don't say, oh no, that costs too much. Why are they doing that for interpreters? We need more people advocating for us when we can't be there. So that's what everyone is charged with doing in 2024. Go out and make friends with an allied healthcare worker and get them to champion our cause, which is language access for everyone who needs it. Thanks for being with me here today. Stay tuned, everyone. Will be more episodes coming in 2024. And thank you so much for being with us today.